So hi, I'm Tom Bond. I'm a Senior Research Associate here at the MRC-Integrative Epidemiology Unit at University of Bristol, and I'm a so-called etiological epidemiologist, which basically just means I study causes and effects. And I will be talking about the consequences of maternal obesity before and during pregnancy. And so when we talk about these consequences that could potentially arise as a result of obesity during pregnancy, we can divide those into perinatal outcomes that occur around about the time of birth in the mums and the children, and also later life outcomes. Chiefly, I'll talk about offspring obesity throughout life. Both are related to maternal BMI and obesity during pregnancy. So it's very clear that observationally, you see these associations, these correlations between maternal BMI during before pregnancy and these outcomes during birth and later in childhood obesity. What's not clear at all is whether they're causal, because I think it's quite clear, correlation doesn't always equal correlation. And so our work is really trying to get to this. Are these associations that we see causal, and then are there any policy implications following from that? And so, as I said, it's clear that the higher a mother or expectant mother's BMI or obesity, however it's measured, is before she becomes pregnant, during pregnancy, on the whole, the more adverse her risk profile for a whole list of perinatal outcomes that you can see along the left here. And this is the important plot here is that the red one. This is the observational correlation, basically. As I said, it's also clear that maternal BMI correlates with offspring obesity risk. The reason I can say this is so clear is because we were excited a while ago to get one of our papers accepted in the highest impact epidemiological journal in the UK. Here it is. And as Ken was saying, you get lots of engagement. So we've got 187 reviewer comments on the website. Most of them said academics, as usual, spout rubbish. bit harsh, I thought. But the other take-home message was that generally overweight parents have overweight children. This is very clear, and it's a bit harsh. We did know this already. It's well described in the literature. Maternal BMI is one of the strongest epidemiological predictors of offspring BMI obesity risk. And so this raises a tantalizing prospect for epidemiologists. Could you control maternal obesity rates to simultaneously kill two birds with one stone, to reduce these perinatal outcomes and reduce obesity risk? And this is obviously even more exciting now. We're starting to get pharmacological treatments that in theory could control maternal obesity rates. And this is exciting. You could in theory control these intergenerational cycles of obesity that can really escalate through generations. It's theorized this could be a major driver of the obesity epidemic even. There's been high-level public health involvement. This is the public health, the director, so the chief medical officer's report back in 2014, where they were very enthusiastic about this idea. And there's also loads of biological work in animals suggesting causal mechanisms, biologically, how this could work. As I said, correlation doesn't equal causation. So to throw a massive spanner in the work, these observational associations, we need to work out whether we can rule out confounding. So confounding is where a third variable causes both the exposure and the outcome. So the classic bit morbid example that's used to teach this is if you had an ice cream stall and you found that the days you sold more ice creams, there were higher deaths from drowning, you might be a bit concerned. But then if you measured temperature and controlled for temperature, the weather, that association would go away. It's temperature that's causing those two variables. There isn't actually a causal effect between your ice creams and deaths by drowning. So we need to think, are there any potential confounders between maternal BMI and offspring BMI? And clearly there are. Mums pass on a lot to their children. They pass on their genotype, they pass on their familial environment. So we need to be sure, as sure as we can, we've controlled for both of these confounding pathways. And there's a whole load of types of evidence that we have at our disposal, epidemiologists, to try to do this. In an ideal world, you'd run a randomized controlled trial where you just give an intervention to two different groups and you follow them up that randomly, and that's the best way to do causal inference. But for ethical and practical reasons, this is really hard to do in pregnancy. And so what we're left with is lots of observational designs that we have to put together. And because all of these designs have strong assumptions, we can't be confident based on any one study design by itself. So we need to really look and see for consistencies and try and triangulate these different study designs together. And if they all agree, they all point the same direction, it can become strong enough evidence to make causal conclusions without RCT evidence. And so, we've heard a bit about Mendelian randomization. There's other methods that use genetic data. I'll be happy to talk about these if people are interested in, but chiefly heritability studies and also comparing mums associations with the father's associations. And so for perinatal outcomes, we find that it looks like there probably is a causal effect. So Mendelian randomization studies and maternal-paternal comparisons suggest that maternal BMI does indeed probably cause perinatal outcomes. So the key points here is the red, that's the observational correlation. It could be confounded. The black is Mendelian randomization, should be less confounded if it's been done well. There's an agreement here, so that's encouraging for causality. The red and the black mostly agree for most of these outcomes. And then when we compare the mums and the dads associations, because it's only the mum that has a uterus and is, nurturing this, this individual in utero, we should expect the mum's BMI to have an effect, but not the dad's, if there is a causal effect. So we want to see a difference, and that's again reassuring. There's a big difference in the mum's effects in red and the dad's effects in blue. So that's reassuring that there's a causal effect. Likewise for lots of the outcomes. So it looks like there is support for causality. It's the opposite case for the later outcomes for offspring BMI. Mendelian randomization, maternal-paternal comparisons, and these heritability studies that we've done more recently, it's just that on the whole, maternal BMI probably does not have a big causal effect on offspring obesity rates, unfortunately. So here is the observational potentially confounded association in blue. Here's the MR, Mendelian randomization estimate in pink. And it's like chalk and cheese. There's a big difference. This could be confounded. This shouldn't be as confounded. This suggests that there's confounding going on. That's bad news. It's probably not causal. And then again, when we compare the mums and dads effects, they're very similar. This is probably because it's the same mechanism that's explaining these two similar associations. So, your mum and your dad's association with offspring obesity is equally strong, and that suggests that it's due to confounding. It's the same causal process, a confounding process that's underlying these associations, and that's driving the similarity in the associations. And so the last bit of work I'll present is where we're trying to ask, if it's not causal, what is the driver? And so based on these two heritability estimation methods, they're different methods, they use different assumptions. They both suggest that it's a big part of the association between mum's BMI and offspring BMI in childhood is explained by genetic inheritance. And I can, the key point here, the blue is the observational association that could be confounded, and the purple is the bit that looks like it's due to genetic inheritance. That's, quite high. And we see a similar story for mums and dads associations. So on the whole, we don't see, based on our data, much support for causality of mum's BMI on offspring obesity, but we do see support for mum's BMI on offspring perinatal outcomes on the whole. So I think the policy implication from this is, if you believe our data, targeting maternal BMI before pregnancy is unlikely to be a silver bullet. It's unlikely to be an effective way to control obesity in the next generation. This is probably because the genes have already been inherited. And so you need to intervene in a way that's going to change the environment that those offspring are expressing those genes in. They've already been given that the genotypes, and they need to have their environment influenced for an effective intervention. So I'd like to acknowledge lots of really wonderful colleagues. Thank you very much. I'm happy to chat about any of the methods in more detail later. Thank you.